Well, good afternoon. My friends, this is a fight of our lives. Monday's modeling showed us a tale of two worlds. On one hand, we're flattening the curve in our communities thanks to our collective efforts. Staying home and physical distancing is really making a difference. On the other hand, we're in the thick of a raging battle against COVID-19 in our long-term care homes. And when you're in a fight like this, you leave nothing on the table because we have a duty to protect those who cannot protect themselves. And we're doing everything we can as a province to support these homes and these residents to support our most vulnerable. But as Premier, I won't stop there. I will draw on every available resource. I will get support and reinforcements from everywhere possible. That includes from our federal counterparts. From the beginning of this battle, we have worked closely with the federal government. There's been tremendous partnership between all three levels of government. And I've had regular conversations with the Prime Minister, the Deputy Prime Minister, and the Chief of Defence Staff. They have offered the resources of the federal government to assist Ontario, and today we'll be making a formal request to bring in those extra reinforcements. This includes resources from Public Health Agency of Canada and Canadian Forces personnel. We will begin by directing that the additional personnel be deployed to 5 priority homes in the province. Their support will provide staffing relief so staff can focus on the care of the residents. They will assist with operations, coordination, or medical care, logistics, and general assistance to support the day-to-day operations. This support from our federal partners will be a small part of our robust response to COVID-19 in long-term care homes. We're putting resources where they're needed most. As I've always said, everything is on the table. We will leave no stone unturned. Our frontline heroes are working around the clock, many working longer days and extra hours. They need a rest, and they need support. We have already assembled COVID-19 SWAT teams. The Scarborough Health Network has sent in medical expertise to 17 long-term care homes in their region. They've deployed volunteer emergency nurses and cleaning staff, provided support plans and training. They've sent in medical experts and created virtual programs to best support staff on site, including 24/7 dedicated expert advice. Our hospitals are stepping up in a big way. Lake Ridge Health has done a scan of all the homes in their region. They've already deployed plans for 6 homes in the region and will have 10 completed by the end of the week. They've deployed geriatric nurses, infection and control specialists, and clinical practice leaders. They're helping the hardworking men and women on the ground complete testing, procure PPE, and set up structures for immediate troubleshooting. We're sending in specialists from hospitals, public health units, and home care sector. These specialist SWAT teams will be supporting over 100 long-term care homes in the urgent need of our support. We are constantly sending in critical medical supplies and equipment, including millions of protective masks and gloves. These supplies are getting right to our long-term care workers on the front lines within 24 hours of request. When it comes to protecting our most vulnerable, we're making sure all hands are on deck. Long-term care homes, hospitals, public health officials, community volunteers, and now our federal partners. And every set of boots on the ground will make a difference in this fight. Because when I see how many families are grieving, when I see the stories of this virus is ruthlessly attacking our seniors, I know we have to keep going. We have to keep fighting. We will keep working around the clock to keep you and your loved ones safe. We will always be there to support you, and we will get through this. Thank you, and God bless the people of Ontario. I'll now pass it over to Minister Fulton.
Thank you again to all the caregivers on the front lines of this pandemic. You are doing heroic work each and every day, and for that, we thank you. We are continuing to see that long-term care homes around the world are at the forefront of the COVID-19 pandemic. The new modeling suggests that community cases may be lessening, and yet the spread in our long-term care homes will continue. Like many challenges Ontario faced before COVID-19, we will overcome this too. Last week, our government announced the COVID-19 action plan to protect long-term care homes. And since then, we have been working collaboratively with the Ministry of Health, Ontario Health, and local public health units to provide continued support to our long-term care homes. And I want to share some further work that has been done as part of our action plan. We have increased testing on both symptomatic and asymptomatic staff and residents. And as the Premier mentioned, over 11,500 tests have been completed. Critical 24, 48, and 72-hour staffing shortage issues have and continue to be identified, and individual response plans have been executed to 22 long-term care homes to help. We are responding to every escalated request for personal protective equipment from long-term care homes and retirement homes within 24 hours. COVID-19 teams from hospitals, public health, and home care have begun to support over 100 long-term care homes. There are 31 infection prevention and control interventions currently in progress. These interventions include infection prevention and control training and measures to support physical distancing in these homes. Our partners in healthcare, like Trillium Health Partners, Halton Healthcare, Grand River, Cambridge Memorial, Niagara Healthcare, Health Sciences North, Lakeridge, Scarborough Hospital, and the Ottawa Hospital have all stepped up to help their local long-term care homes. Through the hard work of our frontline healthcare heroes, there is a light at the end of the tunnel. 20 long-term care homes that were previously declared in outbreak are now outbreak-free. And as we have stood here and said before, everything is on the table to keep our loved ones in long-term care safe. Our government will continue to act swiftly to keep your mothers, fathers, aunts, uncles, brothers, sisters, grandmothers and grandfathers and friends and family in long-term care safe. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier. Maybe I'll get a lot of questions about the long-term care testing, but I wanted to ask about a different subject. This morning with Bill Carroll, you mentioned that you were looking at a sort of May long weekend reopening of the economy. I just wondered if you could flesh that out a little bit.
No, sorry, but I said everything is conditional on the health and well-being of Ontario, conditional on getting the Chief Medical Officer of Health. What I was saying is, can we start opening up a trickle of the economy? I got to be very, very clear. There's never going to be one date that we just open up the economy. We're going to open it up with a trickle and just let it flow from there and constantly measure. But by no means are we going to have, for instance, the May 24th weekend, we're just going to open things up. That is absolutely not going to happen.
Oh, okay, following up then on the schools piece, though, you did say that that Minister Lecce would have some good news on that front, or some encouraging news, or you wanted to give people hope on that front. Does that mean that the school year is not going to be written off for sure?
I can't answer that. Over the next couple of days, Minister Lecce will be coming out with a statement, and it will hopefully give students and teachers and parents some certainty moving forward.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Hi there, Premier. 2 questions for you this afternoon. Why did it take 400 deaths in long-term care homes in order for the government to ask for Canadian Forces help and extra support from the federal government? And also, why has the government not moved to take full control of some of these hardest hit homes as opposed to just working in coordination with management?
Well, before I pass it over to the Minister of Long-Term Care, we had a robust strategy, and this is just enhancing it on 5 homes. We went out and we had a strategy of moving personnel staff from hospitals, which we're doing, moving it over to long-term care homes. We also had volunteers moving forward and supporting us in long-term care homes, and retired nurses coming back. And we also had the health, the support of Ontario Health and Public Health. Travis, it's all hands on deck, and all the help we can get we'll take no matter where it is, and I'll pass this over to the Minister.
So to be absolutely clear, the health and well-being of residents and staff in long-term care are a priority. And this is what we've been doing with that in mind the whole way through. All the measures we've taken, from the active screening to the essential visitors only, to ramping up testing, getting that into the homes. We have been taking the best, the advice of the best experts, our medical and scientific experts on this, through the Chief Medical Officer of Health and Public Health, and all the good people who have been working from Ontario Health and the Public Service, making sure that we take every single measure possible in a timely way. There is nothing more important than the lives of our most vulnerable people. This is a global situation with this virus. It attacks the over 80-year-old age group in a dramatic, deadly way, and the numbers show that all across the world. We are taking every measure and taking additional tools. You've heard our action plan. The testing advice is coming from the Chief Medical Officer of Health, and we're following those recommendations.
Okay, my next question is for the Premier. Families of residents at Orchard Villa and many other long-term care homes say that there has been a profound lack of transparency in terms of the information that they are getting. And as you know, most reports on what is actually happening in long-term care homes is not coming out through public health units or the government, but it's coming out through the media. Now, this is a government that has promised repeatedly from the podium that you're standing at transparency. So how do you square the reality with the talking points?
Well, again, anything I know, Travis, I tell the public. If it's in the afternoon, I tell them the next morning. But I think this is better answered by the Minister here. Thank you.
So there has been some confusion over the numbers. The numbers coming through public health, they have a different path. The numbers that come to long-term care, the Ministry of Long-Term Care, are numbers that are eventually confirmed from public health. But certainly you're aware how quickly things can spread through the media. We're making sure that our homes understand the importance of accepting the support when they need the support. We're making sure those communication channels are open. And our Chief Medical Officer of Health has also looked at narrowing that gap so that there's less difference between the numbers and making sure that we can get information out in a timely way. This is very important.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier. On the military aid piece, what has led you to this point where you're now looking to call in the military to 5 homes? How much aid are you looking for? How many people? What kind of personnel do you need? And why does it seem like your government has resisted every step of the way these proactive calls for more testing, for limiting staff to 1 home, and now military aid, which I asked your government about on April 11th. Yeah. So if you can please answer those questions as to why now and why you didn't do this earlier.
Well, let's go back to the beginning. We had the hospitals open. We thought it was going to be a different scenario. We thought we'd have full hospitals. That's not the case. We reallocated hospital resources over to long-term care to make sure that they have the support, but we're leaving no resources, no rock overturned or no stone overturned, and we're making sure that the resources that are needed there are there. Now, as for the military, this has been changing every single day. As we see an influx, we'll take all resources possible. And as for the number of people, there'll be enough people to take care of the 5 homes, 24 hours. I've never been reluctant to, the call for help. And as for the testing, Laura, there's many people, I was one of them, sitting there beating the drums 2 weeks ago saying we need everyone tested. Again, I can't, as much as people may think I can jump in there and overturn what the chief medical officer says, I can't. I can get up here, and I was shouting and screaming 2 weeks ago, we need more tests, and now we're getting more tests, and we're going to be, by the end of the month, up to 14,000 tests, but there was no one out there that was beating the drum louder than I was. So we're at that point now where we're going to be testing every single resident, every single health worker. There's 78,000 residents, 56,000 healthcare workers within the system. And again, I've been requesting get every single person tested in long-term care. I've been saying this for 2 weeks, and by no means are we sitting back and not putting every single resource we can in long-term care. But as it changes, just all over just 4 or 5 days, we had 114 infected homes, and it's jumped up to 128. And as we needed more resources, we're bringing the resources in from every corner of the country if we have to. But my main focus, I'm just 100% zoned in on making sure we support long-term care. That's where the crisis is.
But Premier, I think a lot of Ontarians and people, especially with family members and loved ones in long-term care, are very disturbed by the delay and lack of action here when the Premier of the province is calling for something and, almost 2 weeks later it has yet to be done. Why is that delay happening, and why does it seem like there is such a schism between what you are calling for in your own province and what your health officials are able to implement?
Well, again, Laura, maybe in the future, maybe that's one of the cracks in the ship. By no means am I a medical professional, health professional. I have to rely, and I do rely, and I have confidence in our health table. And yes, do I push them? 100% I push them. But I'm not a medical professional. I rely on them to move things forward. And there's no one that's been pushing the health table more than I have. Have I been frustrated in the past? Absolutely. Do I get frustrated? 100%. But again, I have to rely on that table. They are doing a good job. They're working around the clock. They're bringing in the resources. But maybe there's time for the system to change in the future here.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
Hi, Premier. Just
Hi,
further on the long-term care testing, are you confident that Ontario will have the ability to test every long-term care resident and every long-term care staffer, the tens and tens of thousands of them that you mentioned? And right now we're doing about 10,000 tests a day. Can we do this, and how long is it going to take?
Well, if we're doing 10,000 a day right now, we're going to bump it up to 14,000. Plus, we have to include the testing the public as well. Yes, we have the resources. We have all the items that we need to do the testing. So we're going to do it rapidly, as quickly and as fast as we can. I've been as clear as I can be. Get in there and test every single person we possibly can. And it might take a few weeks, but we're going to make sure that we expedite it as soon as possible. And every day, people in long-term care are being tested. And just to mention, even in the past, long-term care was very, very clear that anyone that had symptoms, be it a resident or a healthcare worker, was able to call up and get tested immediately. It wasn't that we were holding back tests. Everyone was able to get tested when they showed symptoms.
And I'm wondering if you or maybe Minister Fullerton can just clarify which 5 homes you're looking for public health and military assistance at?
I'll pass that over to the minister.
So we have been keeping very close scrutiny on the homes that are struggling. And these homes will typically be in a regional area to allow the military to deploy into the homes as to support our hardest hit homes. So we're keeping very close track of that. Obviously, Toronto has quite a few cases, and staffing is an issue in those homes, and this is what will be done with the staffing assistance from the military.
Next question.
Next question comes from Cynthia Milligan from City TV. Please go ahead.
Hi, Premier. This question is for you. It seems to me that, I'm going to add to Laura Stone's question. It seems to me from what you're saying that you aren't happy with a lot of the decisions that have been made when it comes to long-term care and the lack of testing that was called for weeks ago and only seems to be starting up now. Are your hands tied here? I don't understand. You're the Premier. I thought you were the one who called all the shots.
Well, the public health officer, that's a separate area. Again, that's totally separate from the jurisdiction under the Premier. He has powers that I don't have. And, he's been doing a good job. He's been working very, very hard. I have confidence in Dr. Williams and our command table. And again, I was frustrated, but I'm not the health expert. I'm relying on them. I have confidence that they're going to do a good job, and they've been doing a good job. It's all hands on deck. We aren't leaving any stone unturned anywhere. We're pulling in as many resources, and as the numbers change, we have to react. We have to react and put more support into the system. And again, can we change things, Cynthia, in the future? Yeah, I think we should change a lot of things after this pandemic, right across all jurisdictions, all levels of government. As I've said, you see the cracks in the ship, and you have to fix them. But I'll always rely on the advice of our medical professionals, health and science. I have to rely on them.
Okay, thank you. And my second question is in regards to people with disabilities. It's very difficult for them to get to assessment centers. Many feel like they're falling through the cracks. The opposition is calling for in-home testing for people with disabilities. Will your government consider that?
Well, if I could pass that over to the Minister of Health, I'd appreciate it. Thank you.
Absolutely. If people need to be tested, we can take the testing to them, especially people with disabilities who maybe have significant mobility challenges. We want to make sure if they need to be tested, that they will be tested, and of course if they need care, that they will receive the care that they need, including hospital admissions, or if they're doing self-isolation, making sure that they have the supplies and equipment and assistance that they need. So absolutely, we're more than willing to extend the testing to bring it to them.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
I've got a question about your these SWAT teams that you have. Anson Place in Hagerville, they have 25 people dead and 47 have tested positive. The union has called for your government to take over the operation of that home. Ontario Health West reached out to the home and offered to send one of these teams to help out in the facility. And the executive director said, "Oh, no thanks, everything's fine here. We don't need you." Why wouldn't the team, the health unit, insisted that somebody go and see what the situation is in that home?
Randy, I agree. Anyone who makes that judgment call, I wonder why they're even in charge over at that home. When you have those many deaths, those many positive cases of COVID COVID-19, why wouldn't you? You know, we aren't too proud to call in our federal government or anyone. I'll take people from anywhere in the country for support, and sometimes pride gets in the way. Well, to that person, I'd say, you know, swallow your pride and start asking for help, and we need to bring people in. But I'm sure Minister of Long-Term Care knows more about that situation than I do.
Okay, my next question is, should...
Okay, so public health does have the ability to issue an order to allow the home to be accessed by other supports. So public health does have that ability, and in some instances it has acted on that. So just to clarify that it is possible for public health to do that. There are other mechanisms as well.
Okay, and while you're there, should every home in the province be inspected right now? You know, wouldn't that make sense? And also, you didn't really name the 5 homes where the military is going to be utilized. Could you name those homes for me, please?
Well, things change very quickly, sometimes hour by hour. So I want to make sure that everyone understands that military assistance will go to the homes that are in greatest need. And so I will leave it there.
Next, this will be the last question.
The last question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, I also listened to your interview with Bill Carroll this morning, and said that there would be some proposals going to Cabinet today, and I understand that you may just simply say, well, that's Cabinet, you can't talk about it, but since you already did, what can you tell us about the proposals that will be going forward to Cabinet in terms of measures that may be relaxed, measures that may be changed in the coming days, given that you've already discussed it in public?
Well, Brian, there's a lot of things that go to Cabinet every single day. There's one item that's going to Cabinet today as well, and we're always looking at the economy, how we can slowly turn it on by a trickle, but by no means are we opening up the economy wide open. That's going to be a long, drawn-out process. We're going to make sure that we do our due diligence, make sure that we communicate with municipalities and along with our federal government before we do anything. I realize, Brian, people, again, are getting a little antsy, but nothing's more important than our health, and we want to make sure that when that time comes, we open up the economy in a trickle, in a very, very small way. We measure, then open up a little more, and so on and so forth.
You keep saying that this is a trickle versus turning it on right away. I don't hear anybody saying open everything up right away, and yet you keep setting up the straw man to beat up and say that you won't do that. What I keep hearing is, can we start opening up in a trickle? So to go back to what you said to Bill Carroll, to go back to what you said to Rob Benzie earlier, you said to Bill Carroll this morning that we could be looking at opening up by the May 2-4 weekend, and then you said at the beginning of this news conference, no, we couldn't. So, we're getting a lot of confusing messages from the public and wondering what's going on.
So, Brian, I listened to the tape, and if you listen to it, I always put the condition based on the Chief Medical Officer of Health. And if we see the curve go down, and keep in mind, we're talking a month down the road, that I don't have a crystal ball, and neither does anyone else. If we keep seeing the curve flatten and start heading southward, yeah, we can start opening up a little bit at a time. But I can't predict a month down the road. I'm hoping it continues going the way it's going, and when it starts heading south, yes, we will start opening up the economy very, very slowly, and not wide open, but we're going to open it up slowly. And I just asked everyone, please have patience, even in regions that there might not be any COVID cases. We just want to open up the economy very slowly. We'll get there. We'll get there, and once we get there, we'll light a fire underneath the economy. But thank you.
Thank you.
Thank you, everyone.